Hi everyone, this is Sumati Christopher from Triple M College of Nursing, Child Health Department. Today we are going to discuss about the fetal circulation. We are going to discuss the fetal circulation with the below given topics: definition, pathway, fetal circulation, transitional period, transitional changes, and the temporary structures involved in the fetal circulation. Before starting with fetal circulation, we'll see the definition, then we'll move on to the circulatory part. So the definition states, the fetal circulation is the circulatory system of human fetus, often encompassing the entire feto-placental circulation, which includes the umbilical cord and the blood vessels within the placenta that carry fetal blood. The pathway involved in the fetal circulation are placenta, umbilical vein, umbilical arteries, liver, ductus venosus, inferior vena cava, foramen ovale, right lung, arch of aorta, ductus arteriosus, left atrium, left ventricle, right ventricle, and portal vein. Fetal heart assumes its normal four-chambered shape by the end of 6 weeks of intrauterine life. The oxygenated blood from the placenta is returned through the umbilical veins which join the portal vein. Most of the umbilical venous blood is bypassed through ductus venosus to the inferior vena cava and it enters to the right atrium. The pressure relations between the aorta and pulmonary trunk are reversed. That means usually the aortal pressure and resistance in the aorta will be more in comparing with pulmonary trunk. Because of this pressure increased in pulmonary trunk, there is a left to right shunt. That means temporary opening established through ductus arteriosus. This opening will be closed when the fetus is or when the newborn is exposed with oxygen. So in term babies within 72 hours of birth this will be closed, but sometimes it will take more than 8 weeks, 8 to 12 weeks it takes to close. So when the baby is exposed with oxygen, the pulmonary vascular resistance continues to fall down. Here we'll see the basic anatomy and physiology of fetal circulation. This has 4 temporary structures. First one is ductus arteriosus. This ductus arteriosus, it's a temporary opening which is between pulmonary trunk and aorta. Second one is foramen ovale. It is a temporary structure between right atrium and left atrium. Third one is ductus venosus. It is the temporary opening between umbilical vein and inferior vena cava. The last one, fourth one, is hypogastric arteries, which is there in placenta. So this hypogastric arteries formulate umbilical cord. Umbilical cord has 2 umbilical arteries and 1 umbilical vein. This umbilical arteries carries deoxygenated blood from the fetus and it reaches to placenta where the gas exchange happens. After this gas exchange happens, the oxygenated blood is formulated and this blood is carried to the fetus through umbilical vein. The umbilical vein first reaches to liver near to the portal circulation. Through the ductus venosus, it joins with inferior vena cava. So before joining with the inferior vena cava, it supplies liver with 100% oxygenated blood. So afterwards, with help of inferior vena cava, it enters into right atrium, where the minimal mix of oxygenated and deoxygenated blood will be possible through the inferior vena cava. So the 80% oxygenated blood will be emptied into the right atrium. In the right atrium, Bloodstream is divided into two portions. The inferior margin of right atrium, it is called as septum secundum. The outer margin, it is called as septum primum. There is a pressure change between left atrium and right atrium. The pressure in the right atrium is more than left atrium. Because of the pressure changes, the septum primum separates from septum secundum and establishes a temporary opening, which is called as foramen ovale. So the blood from the umbilical vein, which empties into the inferior vena cava through ductus venosus, which comes and reaches to right atrium. From right atrium, the oxygenated blood is passed through the foramen ovale and reaches to the left atrium. From left atrium, with the help of pulmonary veins, it reaches to left ventricle. From there, it supplies to the upper portion of the body through ascending aorta and to the heart through coronary arteries. The deoxygenated blood from the upper portion of the fetus is emptied into the superior vena cava. Superior vena cava carries this deoxygenated blood and enters to right atrium. Through the tricuspid valve, it enters to right ventricle. From there, the deoxygenated blood carries through the pulmonary artery to the lungs. Already, lung is collapsed and there is an increased vascular pressure and resistance. Because of that, small amount of blood enters into the pulmonary trunk and through the ductus arteriosus, it is between the aorta and pulmonary trunk, it enters into the descending aorta and it supplies to the lower portion of the fetus. That means the mixed blood, oxygenated and deoxygenated blood mix will be there. This blood will be supplied to the lower extremities of the fetus. After birth, with first breath, oxygen enters into the lungs, thereby pulmonary vascular resistance rapidly falls down. So it results in pulmonary blood flow to increase. So thereby the pulmonary vascular resistance decreases. Simultaneously, because of clamping the cord and cutting of the placental circulation, there is sudden increase in systemic vascular resistance. So because of this pressure changes, the pressure in the left atrium, it increases than right atrium. Because of this, the two septa, the septum primum, septum secundum. So the septum primum pressed against each other and the foramen ovale closes. The main differences between fetal and postnatal circulation, we'll see it now. In fetal circulation, that is the placental circulation, which provides gaseous exchange to the fetus. So the lung, which is collapsed because there is no exchange in the lungs. There is a ductus venosus where the portal vein and inferior vena cava provide low resistance because of the umbilicus venous blood flow to pass. Next is there is a widely open foramen ovale which enable oxygenated blood to reach the ascending aorta and distributes to the vital organs, and it empties to the coronary arteries whereby the heart is supplied. Next is there is a wide open ductus arteriosus which allows right ventricle to empty the blood into the descending aorta, thereby the lower portion of the fetus is supplied. Fetus to newborn transitional period. It is amazing and it is crucial and it is vital to monitor. Why? Because majority of newborn undergo this with minimal support, but 10% of newborn needs intensive care. That means the breathing support and aid to adapt to extrauterine life. But 1% of them needs critical care that we have to assess properly. The transitional changes at birth. It's already discussed. When the first breath happens, oxygen enters into lungs. There is a vascular resistance decrease. Thereby, oxygen saturation is increased and blood flow to the lungs is happening. Thereby, the circulation starts and temporary structures closes. Intrauterine period, the lungs are often with increased resistance to blood flow. Fetal lungs expanded and filled with fluid, not with air. So it do not play major role in fetal oxygenation. But after birth, placenta no longer can be a source of oxygen supply. So the baby will have to depend on the lungs for oxygen supply. This transition has to happen within seconds. The major changes in newborn after birth: absorption of fetal alveolar fluid into the pulmonary lymphatics. So it happens first. Then it's replaced by air by the baby's initial breath. So when the baby takes initial breath, the atmospheric air enters. This contains 21% of oxygen and this diffuses into the blood vessels which surrounds the alveoli. Use the lung to supply oxygen for its survival. The transition takes within seconds and may take 10 minutes for the babies to achieve 90% of oxygen saturation. During intrauterine period, there are several temporary structures in addition to the placenta and the umbilical cord that enable the fetal circulation. They are ductus venosus, which connects umbilical vein to the inferior vena cava. This connection is vein to vein. Next is ductus arteriosus, which connects the main pulmonary artery to the descending aorta. This is between arteries. Next one is foramen ovale. This anatomic opening between the right atrium and left atrium. Next, hypogastric arteries. The iliac arteries become the umbilical arteries when they enter the umbilical cord. Thank you. See you in the next video. References. Most of the references is taken from Care of the Newborn by Meghaband Singh, 9th edition, and some of the net resources.